Hello, and welcome to my presentation, Diabetes and Exercise, Diverse Treatment for Diverse Cases. So, I want you to think of a time when you enacted a positive and lasting lifestyle change. Now, this could be anything. This could be, a time when you took up a new active hobby that you continue to really enjoy to this day. This could be a time when you finally were able to implement a strategy to cut a problem food out of your life for good. Anything. I bet everyone in here has a couple stories about this, like something like this. And I bet they're all good stories. And I also bet that they also all have something in common. And what they have in common is that these changes were made on your own terms, and they fit into your life and your daily schedule as much as possible as it was already. Because even if you want to become the model of perfect, healthy habits, you can't possibly do it all at once. And trying to do so is only going to lead to burnout, as I'm sure we've all seen and experienced. So that is the key, as I'm sure we're all aware, to lasting positive change, is to make it work for you. And this is something that is very applicable to the management of diabetic symptoms through exercise. I bet you can probably already guess where I'm going with this. So, the prevalence of diabetes is a persistent and growing problem in North America and the world, having reached global epidemic proportions over the past 50 years. It is generally accepted in the public consciousness that exercise can be a productive avenue of prevention and treatment, making it an extremely relevant topic for people who work in the fitness industry. However, public perception does not consistently match reality, and professionals must be properly informed in order to think critically about claims others in the industry may be making. Current knowledge suggests that exercise is a proven method of managing symptoms and effects of diabetes, such as glucose levels and CHD risk. However, evidence isn't entirely conclusive, and the effectiveness will depend greatly on the patient's receptiveness to the exercise program, something that can be improved by tailoring it to their needs. Now, so for some time, exercise has been a proven method of reduction and stabilization of glucose levels in individuals with diabetes. However, there has been extensive research into what the ideal program to prescribe is. The benefits of aerobic training compared with resistance training are subjects of study, with prioritization of aerobic training being associated with the most consistent improvements in individuals with type 2 diabetes, as well as type 1. Studies also suggest that exercise intensity has negligible effect on the extent of symptom reduction, and that adherence is the most important factor in the successful use of physical activity for diabetes management. Now, this is great news and knowledge that healthcare professionals use to their advantage, as reluctant subjects are generally more likely to adhere to a low-intensity routine than a high one. Or are they? Because if you think about it, sometimes a higher intensity routine to some people might have a greater amount of appeal. And I'll get to that in a moment. Now, I have to put in a disclaimer here. Adherence is not the only challenge in the management of diabetes through exercise. As physical activity is not the only factor that puts individuals at risk for diabetes, other metabolic disorders, and CHD, It cannot possibly be a fix-all. This is shown in the rate of improvement of these conditions among test subjects. Access to facilitators of physical activity is an important factor, as it is in any lifestyle change. I mean, you have to think that your thing you're trying to do has to be accessible. But the underlying causes of increased rates of metabolic diseases and CHD are far-reaching problems that must be taken into consideration when attempting to utilize any tool against them. It is not just exercise or lack thereof that is having that is causing more people to develop type 2 diabetes. So while these health issues are epidemic in the population, change is often most enactable at an individual level, as a program tailored to the preferences and schedule of an individual increases their likelihood of adherence and therefore improvement. And because diabetes, again, it really now affects a hugely diverse group of people. It's not just like, an old person problem anymore. Lots of young people develop type 2 diabetes. And so this only adds more diversity. Not that, all old people like the same thing, but this only adds more diversity to the people affected, and therefore to the variance in the kind of lifestyle changes that are going to work for them. Now, this study suggests high-intensity interval training as a time-efficient method of exercise, since an increase of intensity is not shown to induce negative effects. They suggest that for busy young professionals whose main reason for not sticking to an exercise program is time, high-intensity interval training, for instance, would be perhaps an excellent solution. And its prevalence as a fad at the moment might add to this appeal. However, among older individuals with more spare time, lower intensity regimens are likely to have a wider appeal, although above all, it is important that a wide range of options are suggested, as individual appeal and accessibility reign supreme when it comes to adherence. You'll get 18-year-olds who'd rather go for a half an hour walk, and you'll get 65-year-olds who want to do CrossFit. Everyone's different, and that's the whole point of this. So while it is not an infallible or simple solution, exercise is accepted in the academic community as an effective tool for the prevention and management of diabetes. Exercise programs must be tailored to suit the needs of individuals to maximize adherence. Fortunately, the nature of the effect of physical activity on metabolic syndrome allows a lot of room for personalization with regards to intensity level and duration of exercise, and therefore a lot more potential for individual adherence. Thank you very much for listening to my presentation. I'm going to show my references and image credits for this presentation. All right, thank you for listening.